Welcome, everybody, to Burn It Down with Kim Brown. And of course, the talk around the country is around how to safely reopen the nation, but it doesn't appear as though the conditions are favorable for reopening, as it appears the coronavirus, is accelerating, it is mutating. There are newly discovered strains here in the US, in addition to a failed vaccination rollout. States across the country are reporting vaccination shortages and delays in getting some of the most vulnerable people vaccinated. So, why is there a bipartisan push in both Republican states and Democratic states, governed states that is, to reopen schools? This message is even coming from on high, from Joe Biden in the White House. Part of his mandate of the Biden administration's first days is to figure out a way to safely reopen schools, but the pandemic is not quite under control. Well, such an argument is also raging here in Maryland, specifically in Baltimore City. Governor Larry Hogan has taken a hostile posture towards educators about reopening, and that is where our conversation is going to begin. Today, we are joined with Corey Gaber. Corey is a founding member of the Baltimore Movement of Rank and File Educators, also a VP on the Baltimore Teachers Union Executive Board. He's joining us today from Baltimore. And Corey, we're talking earlier in the day, just so our audience is aware that we are not live at 5 o'clock because there is a very important meeting of the school board to talk about these exact topics. So first of all, thank you so much for making some time to share with us the perspective and how teachers are feeling in these extraordinary times.
Thank you so much for having me.
So Corey, let's kind of sort of start with where we are, right? So here we are, February almost, 2021. We've been dealing with the pandemic 12 months, but schools have relatively been closed for the past 10, 11 months. And at the point in time in 2020, when public schools closed, we are worse now in the pandemic in terms of number of infections, clearly in terms of number of people who have died from the virus than we were 12 months ago. And a year ago, it was sort of a consensus that, yes, we should totally close schools because we don't fully understand the nature of this virus. It's a pandemic. It's very deadly. But even though we seem to understand more scientifically about the virus, what is coming out of the messaging from public health officials is not jiving well with what politicians are insisting upon reopening schools. So let's start there. What is Baltimore City School Board trying to do with Baltimore City Public Schools?
Yeah, so, first off, it's worth mentioning that the Baltimore City School Board is one of, if not the only school boards in the state of Maryland that has not taken a vote on the matter of reopening. So we don't actually know exactly where they stand. The CEO of Baltimore City Public Schools has put forth a plan to expand in-person learning programming, starting as soon as the beginning of February, where educators in certain grades, kindergarten through fifth grade and ninth and 12th grade, would start to be mandated back in buildings based on a sort of school choice portfolio market-based model that says we have a portfolio of schools. Each parent will get to say whether they want their student to be learning in person or continuing to learn virtually, which means every single school will have a different ratio of students in person versus at home. And then the district will mandate those staff necessary to be back into the school buildings to meet the demand of the in-person learners that parents have chosen. So that's what has been proposed by the district. And educators and school staff that make our buildings work are pretty overwhelmingly opposed to the plan for a variety of reasons, which I can start to get into now, or if you want me to wait till later to jump into the specifics.
Nope, get right into it. Why are teachers and educators opposed to this proposed plan by Baltimore City School Board?
It's not safe, period. And how do you define what is safe and when is it safe to get back into schools? Well, if you just look at the state's own guidance that they have put forth saying these are the public health metrics that we will use to decide when to do school reopening, they look at two things primarily: the positivity rate, the case rate per 100,000 people over the past week. So let's look at Baltimore City. According to their own decision-making tree, if you are above 5% positivity rate, you go into one category. Guess what? We're over 5%. And then you look at the case rate. It says if you are at 15 cases or above per 100,000 people in the city over the past week, you should have quote unquote limited or no in-person programming. We are at 35 to 40, depending on the day. So more than double, almost triple the boundary that they have set forth as when we should have limited or no in-person programming. So now that the new variant is starting to attack Maryland and Baltimore City, where there are confirmed cases, even though the public health data says it is not yet safe to do so by the state's own standards, Baltimore City Public Schools is saying, let's move forward anyway. And so it's upsetting to educators on a variety of levels. One, we are literally jeopardizing not just our lives, but the lives of our students and their family members if we expand in-person learning in the middle of the pandemic when the public health metrics say it's not safe to do so. But it's also even more complicated in Baltimore City because obviously we have a long history of redlining, which means that you have what's called in Baltimore the black butterfly, where you have the intentionally segregated districts, the white L of moneyed white folks as a result of redlining policies and all sorts of other banking and housing policies over the years that are, completely racist, provable, and connected to federal, state, and local government policies. And if you look at the rates in the black butterfly compared to the white L, you'll notice, like with many other public health metrics, that you're going to have a higher positivity rate, you're going to have a higher case rate, you're going to have more folks who are vulnerable to both getting the virus and then suffering worse health outcomes when you get the virus. Because guess what? The Black families that are primarily the families that Baltimore City Public Schools serve in the black butterfly also have a higher percentage of people living in homes, more people in the homes, intergenerational homes, higher percentage of people who are themselves essential workers in the homes, which means they are more exposed and vulnerable to this virus. And you put all those pieces together and then you reopen schools as well, you are basically choosing to expand this pandemic and you are choosing unnecessary death that can be avoided. So that is deeply upsetting. People are filing for accommodations if they have somebody with extremely deep, high risks in their own home, children of theirs with super special needs, grandparents who they're taking care of. All those accommodations are being denied. Baltimore City Public Schools has an explicit policy that says we will not grant you any accommodations if you have vulnerable people in that household. That is not a legitimate reason for us to grant you an accommodation. And it's just, it's inhuman. It's inhuman. And that's on top of everything I just said, in Baltimore City, again, because we're a portfolio and choice district, that means that students just don't go to their neighborhood school, right? There's an entire school choice process. We have the language and logic of the market that have invaded our schools now. And so students don't just go walk 2 blocks to their school. Most of them have to take public transportation, many stops across the city, taking more than an hour in order to get to their school building in the first place, which means they are now getting exposed to all sorts of folks on the bus where, guess what? You're not going to be able to enforce social distancing and mask wearing. If any of your listeners have been on Baltimore City's public transportation, a lot of people work hard and do a great job, but social distancing and mask wearing, that is not happening with fidelity. So now you have students that have violated all the cohort integrity that you're trying to set up, and they're coming into buildings, and it's just going to be a mess. It's a bad plan. It's an unsafe plan, and it will literally cost people's lives.
And a lot of people would argue that Baltimore City public schools, or at least some of them, are inherently dangerous even pre-pandemic. And I'm talking about from simply a maintenance perspective. Every single summer and winter, there were stories of city schools being closed because they lacked proper air conditioning or they lacked proper heating, where students were unable to drink out of water fountains because of the lead contamination in the water. So everything that people would hopefully have to, or students would have to keep them safe inside the school building, let's say a HEPA filter and good ventilation and proper air circulation and clean water. I mean, those things are literally inaccessible to them. To your knowledge, has Baltimore City Schools taken any efforts to improve the infrastructure of some of these schools in the schools that they are proposing hybrid in-person learning?
Yeah, great point. And I'm glad you raised this issue because I forgot to mention it in my initial diatribe. But when it comes to school facilities, right, they certainly know it's a problem. Even before the pandemic, as you mentioned, we had a $3 billion, billion with a B, backlog of essential maintenance work that needed to be done in buildings that Baltimore City Public Schools could not do because they literally lacked the resources to do the work that they know needed to be done. Again, that is not the fault of current city schools administration. They inherited, decades of racist underfunding. But we do have to acknowledge the reality of, like you said, we literally can't drink the water in our schools. We do not have functioning HVAC systems. So what has city schools done? Well, they have made investments to try to get new MERV 13 filters, new air purifiers into these spaces to support with safer learning conditions. But, and here's some of the big problems, according to their own data, 74% of their buildings have not completed the ventilation upgrade work. And yet, despite that, they have still been holding in-person programming in school buildings where the ventilation work has not yet been completed. So that does not give folks a lot of trust and faith that these will be safe buildings, given the inherited racist history that we have, and given that city schools' current administration has already been willing to put people into buildings where the ventilation work has not been completed. And by the way, even if you have a good filter in there, that doesn't mean you're getting the proper rate of air circulation, air exchange that are measured in other places. And so if I've got a great filter, but the air is not flowing, I don't have a good air exchange, and you can't open the windows in most Baltimore City public school buildings, it's still not safe, even when you finish that. So, one of the big demands that teachers have been saying to Baltimore City public schools is, one, the public health data has got to be right. But two, you have to finish the ventilation work before you force people back in. Otherwise, it is not safe.
Corey, earlier this week, or really on the 21st of January, Governor Larry Hogan, in his daily press briefings about the COVID-19 pandemic in the state of Maryland, said, quote, "There is no public health reason for county school boards to be keeping students out of school. None," end quote. Now, he said county, but we know he meant city too. What is your reaction, and what has been the reaction of other educators hearing the governor, who claimed that the state of Maryland would be following the science on how to safely reopen, understanding that this messaging coming out of Annapolis is in direct contrast to what public health officials are saying constitutes a safe reopening. What's your reaction to Governor Hogan, and what's been the reaction of your fellow members?
It's laughable. He has a very tenuous relationship with the truth. As we said earlier, I already named two public health metrics: the positivity rate, the case rate per 100K. Those are the metrics we didn't come up with. The state put forward in their own guidance. We are far beyond the threshold that they put forward. So when you say there's no reason, I'm literally pointing to two reasons based on your own data and your own guidance that you sent out. And that doesn't include other alarming public health measures, like, for example, the CDC, their primary measure they put forward when deciding when to reopen in-person learning program is they have another metric where they look at the case rate per 200K over the past couple of weeks. And then they have different categories from safest to moderate risk of introduction and transmission to the highest risk category. To get into that highest risk category, you got to be above 200. Baltimore City is at 550. Again, almost triple the threshold to get into the highest risk category. We are so far beyond what is safe. Again, according to the science, according to the public health metrics that the CDC and the state themselves have put forward, that it's absurd for the governor to make that claim. And it's clearly about something else. It's also laughable to our members to hear that from the governor, considering this is the same man who vetoed the blueprint bill for Maryland's future that would have increased investments into public schools, and by association, the Built to Learn Act that would invest in improving our schools' infrastructure. Again, these are the things you need to actually reopen schools safely. So if you are actually committed to reopening schools safely, maybe you should not veto the funding that would have made school buildings safe in the first place.
And it's also laughable for Larry Hogan, a two-time cancer survivor, to have the audacity to tell people, teachers, educators, school nurses, school custodians, school administrators that school is totally safe to open. And I'm like, okay, Larry Hogan, then why don't you go stand in the lobby and greet the kids as they are welcome back to school? And it's like, otherwise, shut your mouth. But I want to talk about the vaccination rollout, because that has gone almost, I want to say disastrous, because I'm not exactly sure about the situation in Baltimore City, so I'm counting on you to enlighten me. But I live in Prince George's County, where there are long lines to get vaccinated. State websites are directing residents who live outside of my county to come into our county to take our vaccinations away from vulnerable groups like Prince George's County seniors, in favor of Montgomery County residents, for example. And Montgomery County says that they have been under delivered with vaccinations, whereas rural counties in the state of Maryland, like Kent County and Somerset County, have vaccinated higher percentages of their population relative to the amount of people that they have living there. There's 1 million people in Montgomery County. There's 600,000 people, rough, give or take, in Baltimore City. How has the vaccination rollout gone there?
So Baltimore City's vaccination rollout has been significantly slower than the rest of the state, particularly for city school staff. So let's do a little comparison, right? Prince George's County, they are rolling up to have 1,200 vaccinations for school staff members per day, 1,200 per day. Baltimore City only started last week, and they're doing 500 per week, 500 per week versus 1,200 per day, right? And so that means even with staff who are willing to volunteer to go back into buildings, once they've been fully vaccinated, we are restricted by the problems of the vaccination rollout and the speed at which it's happening in order to get people back into buildings, even for the folks who want to do that. And so there's also clearly a lack of communication between the state and the district, as there was between the state and most districts, because they initially said, hey, educators, you're ready. You guys can start signing up. And people started signing up. And then we got different messaging from city schools saying, no, don't go through the state. We've got our own partnership that we just made with Johns Hopkins University, and we're going to go through them. So don't sign up through the state, but do sign up through us. And here's how you sign up through us. So now we already have this bifurcated system where some people are going through one place, some people are going through the other. We've heard early anecdotal reports from the people who've gotten their vaccinations from the state that it was actually a very smooth, quick, and easy process. The ones who've gone through Johns Hopkins University and the city schools partnership have had to wait multiple hours before they're able to complete that process. So it's been kind of a mess. And again, if we're actually committed to opening schools when it's safe and you want that to happen sooner, the governor and others could focus on getting more vaccines and increasing the speed of the rollout as fast as possible.
So I wanted to also ask Corey, in terms of how are the students doing? Well, how are the students and the teachers doing? I can understand the arguments from some parents and others, mainly politicians, I suppose, who are insisting that these lockdowns have had a detrimental effect on kids, on their mental health, on their socialization, on their ability to learn effectively, which I don't think anybody disagrees with. But when people say we just should reopen schools, it's like the schools are closed for a reason. They just didn't decide just to arbitrarily close schools and make you deal with your kids, all day, every day. So how are students and teachers faring in these lockdown learning times?
These are rough times. People's mental health have taken a hit, in part because we don't know whether we are going to be forced back into unsafe situations that will jeopardize our lives, the lives of our students, and the lives of their family members. That is a heavy burden to bear. And just because in the past, the United States has depended on public education to basically take care of kids so people can go work their jobs, does not mean that's the right system. Nor does it mean it is schools' fault when you have made schools be the place where kids are fed and are getting their mental health treatments and services and all the other things that all communities should have, but our country does not have. And because of that situation, the pandemic is exacerbating these already existing inequities. But the answer to that is not to then reopen schools to kill more people. That does not fix the mental trauma by having your grandparent die. And even if you put public health aside and it was just about learning, reopening schools right now is not going to look like pre-pandemic learning. What they are going to have to do is they will force people in, the students who have chosen in-person learning, and instead of having a teacher that is 100% focused on them, they're going to have teachers sitting in a classroom with students in front of them with their masks on in different isolated bubbles, not being able to move. Meanwhile, the teacher will be in their own isolated bubble with their mask on, where you're not able to see their mouth moving. And then they're going to be live streaming to their virtual students simultaneously that they're responsible for. So now I'm teaching my virtual students and my in-person students at the same time, which means neither one is getting the same educational product. Now they're actually getting a worse version of both. Instead of me just focusing on virtual, investing in virtual to be better. And so, again, if your goal is just learning gaps, which is a problematic framing in the first place, if you put aside public health data, which is a terrible idea, it still won't achieve their stated ends because you're going back into a chaotic, not well-planned situation with people who cannot solely dedicate their attention to the students in front of them because we don't have the funding and staff to properly do that sort of hybrid model. How are students doing? It's also a struggle. A lot of older students are now working. A lot of students are failing. It's not because they're not trying. It's because instead of going to classes, they're working during the day to support their family members. Meanwhile, there's an increased level of tragedy and death and sickness. And anytime you personally or your family is experiencing death and sickness, that has a lasting impact on your mental health. So people are upset, people are stressed, and all of that is exacerbated by the fact that we don't have a clear and safe plan for how to deal with this situation. And we hear new announcements every 2 weeks and reversals from our leaders and gray areas and incomplete, not comprehensive, nonsensical plans that aren't going to achieve their own stated ends. And that adds on top of the already existing trauma that folks have experienced during the pandemic, as opposed to let's finally take this opportunity to get ahead of this thing, get it be completely safe so that we can get back to the type of learning that y'all actually want in the first place. But you won't be able to do that if you reopen too early, unsafely, and then extend the pandemic as a result.
It seems as though if there is any sort of improvement in the pandemic numbers, if we experience a dip in infections or a dip in hospitalizations or ICU folks, all of a sudden the elected officials are like, look, see, it's getting better, time to reopen, without understanding that, these things ebb and flow. And while we may be experiencing a temporary dip, if we reopen things too soon, then that will hasten the spread once again. Corey, I want you to let's play fantasy if we could, right? Imagine we didn't live in this capitalist hellscape and there weren't idiots running this entire situation. What would have been the ideal situation, the ideal way for both students, parents, and teachers to cope with this pandemic and still get some learning in? What could have been done differently? And I know that's probably a very loaded question because there's probably 1,000 things that could have been done differently. But if there were teachers actually running this situation, how should this and how could this have gone I guess, minimize the stress and minimize the hardships on families and educators alike?
Yeah. This is a fun game to play. I wish this was the world we lived in, but, it takes massive investments, resources that have to come from the federal level where they're able to print money as they please, like they do for Wall Street without blinking an eye. Those investments could have been put towards K through 12 education in a variety of ways. One, why is it that we have this thing called the internet and laptops and computers that people literally depend on to interact into this world, both socially and for their education? And yet in Baltimore City, over half the students do not have high-speed, high-quality internet, where we have a monopoly from Comcast that we can't get any sort of better deal. So if I need high-speed, high-quality internet to access the internet, right, to access my education, and I don't have that, we should be investing in public broadband at the federal level, at the state level, at the local level, so we're not depending on for-profit corporations to decide whether or not a student in Baltimore City can access their constitutionally guaranteed right to an education. That is absurd, and that is something that is within the federal government's control to invest in and change very quickly. They haven't done that, right? Two, the vaccine rollout could have been a lot better, right? And if there had been a plan from the beginning where we said, listen, this is what the public health data says. This is when it will be safe. So we will not open until we have an extended period of time below those red lines, right? We'll establish them. Everybody knows what they are. And guess what? We're going to at least go through the spring all virtual setting. You don't know every week whether you're going to be mandated to go back into an unsafe school building for some students, but not others, in a weird half hybrid plan. Now, what you could do, again, is you say, listen, the students who have not been able to engage in school, who need extra supports, we can work harder to vaccinate educators as fast as possible. And then just using the educators who have been vaccinated, who have volunteered, you have made massive investments in infrastructure to complete all the ventilation work and the issues connected to that. You have put in work to ensure that we have the PPE and resources and sanitation materials and transportation so that students can get to and from school buildings safely. Then you could bring in very small groups, just with the staff who's been vaccinated and volunteered, right? And just with the students with special education needs, who are English language learners, who are currently failing their coursework and are in need of some more small group instruction and supports. And you could do a phased in rollout when it's safe, starting with very small groups of the neediest students, and build up as it becomes safe and more people, staff members are fully vaccinated and all the ventilation work has been completed. That would have been a thoughtful, reasonable plan where you wouldn't have had all these battles between the districts and the unions. And by the way, students would have gotten a better virtual learning experience if you'd made those investments in internet access and in virtual teaching and learning, which, right now we're using a lot of curriculum that we're basically beta testing on behalf of a for-profit corporation, which frankly, their online tools have been crap, but we're paying them tons of money to experiment and beta test their new internet tools on our students. So all these investments could have made a tremendous difference for the quality of learning that students were having and our ability to start engaging in that learning in person a lot sooner.
Corey, last question I want to ask. I know you've been paying attention to what other teachers in school districts across the country are enduring. And yesterday, on Monday, the 25th, Chicago public schools were slated for a partial reopening of some in-person learning. But the Chicago Teachers Union and their members decided that teachers were not going to show up. This was a very powerful statement to the mayor of Chicago and to the Chicago public school system that teachers are afraid. They are not comfortable. They are not prepared. And clearly the city resources, similarly to Baltimore, the infrastructure there, Chicago public schools are dealing with a lot of the same things that Baltimore City public schools deal with as well, in addition to a slow vaccination rollout in Illinois where all public school teachers have not yet been vaccinated. If teachers in Baltimore City are mandated to show up to the classroom and the conditions to do so, quote unquote, safely have not yet been met, what are the actions that the union is prepared to possibly take? I'm not going to put words in your mouth, but that big S word is looming. And a lot of people in the labor community are looking at teachers to see what teachers are going to do here. What are your thoughts about what the Chicago Teachers Union did and is doing? And are Baltimore City teachers, BTU members, prepared to do the same thing if put in a comparable situation?
Yeah, we look up to the Chicago's Teachers Union as just, the most badass union out there right now. They have organized the heck out of their members, out of their the students, their parents, community members, and they are jointly united. And so as a result, they have more power than the mayor almost, as they've demonstrated when they've gone on strike in the past. Baltimore City and Maryland have a slightly different situation that makes it more challenging for us to just say, well, we're going to go on strike in the same way that Chicago has done in the past. In Maryland, it's actually illegal to strike. And Furthermore, it is in Baltimore City Public Schools contract with teachers and paraprofessionals saying it is illegal to strike. And furthermore, if it is determined that leadership has organized a strike, we can be decertified as a union, and a contract that folks have spent 30 years to build up could be erased in a second. Furthermore, right, if there's a dispute about, well, is this a strike or not? Well, that goes to the PSLRB, this Labor Relations Board. In Maryland, that is staffed by Hogan appointees, Republicans who are anti-union and would love the opportunity to destroy union power. So it's a different scenario when you compare Maryland to Illinois, where in Illinois it is legal to strike. They don't face a PSLRB staffed by Republicans who are down to destroy unions. And so it's a much riskier proposition for our members to want to take that more dramatic action. And as a result, it doesn't feel like we have the level of support that you would need from membership to take that risk right now. Our folks are willing to consider all sorts of other actions. So, there have been hashtags on the internet. There have been plans for petitions. There have been rallies. There's a car caravan being planned right now. So there are other direct actions people are organizing and working towards right now in Baltimore City. But because of our less favorable circumstances with state law and the PSLRB, us striking could potentially mean the end of the Baltimore Teachers Union. And so folks are less willing to take that more dramatic step right now.
That is extremely chilling for teachers, educators, school staff. That's very disappointing, and I'm sorry to hear that Baltimore City teachers that contract in that language in those circumstances, if they wanted to strike, that it is illegal to do so. So I always say this: Maryland, not as progressive as advertised, right? Not at all. Corey, I appreciate you making some time. I know the meeting is tonight, so we will certainly be watching and paying attention and hoping that sensible, science-driven decisions are made to help keep students and teachers and faculty safe amidst a pandemic that is nowhere being under control yet. Guys, we've been speaking with Corey Gaber. He is the founding member of the Baltimore Movement of Rank and File Educators. He's also a VP on the Baltimore Teachers Union Executive Board. He's been joining us today. Corey, we appreciate your time, and more importantly, we appreciate your work. And thank you so much for all you do.
Thanks for the opportunity to speak with you. Really appreciate it.